Live from downtown Detroit, home of WDIV and Click on Detroit, Local 4 News at 6 starts now.
Openly defiant, a new warning tonight from the AG's office to businesses that aren't yet supposed to be open during the stay-home order.
And there are growing concerns about Michigan's nursing home policy that moves COVID-19 patients to regional hubs.
Good to have you with us for Local 4 News at 6. Let us start today with a quick look at the biggest headlines in the fight against coronavirus.
The state is reporting 33 new deaths from COVID-19. We've now lost a total of 4,584 people to the virus. Case numbers continue on a downward trend with 414 new cases confirmed.
Central Michigan University announcing today it plans to reopen this fall with in-person instruction and new safety measures in place to limit the numbers of students in classes and residence halls, joining Northern Michigan with similar plans.
And in Lansing, the Capitol Commission, which is in charge of the state Capitol building, met today to discuss a possible ban on guns there. They got input from the Attorney General and Senate Majority Leader, but no decision has been made.
Meanwhile, Governor Whitmer said today one of the questions she's been getting the most is from people who live up north or in more rural parts of the state who want to know why areas with the lowest amounts of cases have to abide by the stay-at-home order.
The governor emphasized COVID-19 is still in 79 out of 83 Michigan counties, but says there's room for discussion about different approaches by region.
We're looking at this epidemic to ensure that the density and trajectory is in the right path, so that we can consider some perhaps regional differences. So there's a chance that some regions will re-engage at different paces than others. But at this juncture, we've taken a few bold steps. We have to measure, continue to build out our public health system, and then we'll have a better understanding of if we can maybe make some decisions based on regional experiences with COVID-19 and ability to combat it.
And as for unemployment payments, which some Michiganders are still struggling to file for and to receive, Governor Whitmer offered reassurance that funding will not run out. She says there was $4.6 billion in the trust fund prior to the pandemic. That's third highest in the nation. And Whitmer says if necessary, the state has the option of borrowing interest-free from the federal government. But that option, she says, does not yet look like it will be needed.
Speaking of federal help, at the White House briefing this afternoon, President Trump announced that $1 billion of funding is heading to states to help build up $11 billion heading to states to help with coronavirus testing capabilities.
This partnership has truly flourished. We have really had a very good relationship with the states and the governors and other representatives within the states. A relationship like I think I can honestly say has not been seen in this country for many, many years. The governors and us are working together very closely, not only on testing, but on ventilators, where we have a capacity that's at this point virtually unlimited.
Much more coming up from the president's briefing ahead at 6:30 on NBC Nightly News with Lester Holt.
Well, we know one of the populations at highest risk for COVID-19 is seniors in nursing homes.
Michigan has been putting long-term care patients recovering from the virus in the same facilities with patients who don't have the virus.
This is a policy New York Governor Andrew Cuomo just changed in his state because of the large number of deaths there. Local 4 business editor Rod Maloney is live tonight with more on the story. Rod.
Yeah, Kimberly, you know, the state has announced today that we had 4,584 COVID-19 deaths so far. A sad number, tragic number. And I just found out about 10 minutes ago that the Department of Human Services is saying that 15% of that number came in Michigan nursing homes. But they're also saying with the caveat that it probably is more than that or could be more than that because they're not sure about the reporting of all of this coming from nursing homes. And so that has many people wondering about the wisdom of this particular policy. And one of them is State Representative Lisa Love from the city of Detroit.
And so to return seniors into an environment, seniors with the virus, still recovering from the virus, into an environment with well seniors just didn't seem like it's not a good idea.
And yet, this afternoon, the state's chief medical executive, Dr. Janae Khaldun, when asked about the practice, said,
"It's a good move. It's a good step to make these regional hubs. And I think as we move forward, we have to look at making sure we're really implementing best practices, looking at other best practices across the state as well."
Originally, the state wanted these patients to go to the TCF Center, but that didn't happen, and it closed the facility to much fanfare. Now, across the state of Michigan, 19 regional hubs are operating. This one, Evergreen Health and Rehab Center in Southfield, is one of 3 in Oakland County. Wayne County now has 8, including Regency at Shane and Advantage Living Center in Redford. This last one is near and dear to the heart of Democrat State Representative Lisa Love. Already trying to get answers about regional hubs, last week she found out her 86-year-old mother resides in one. Her mom's COVID negative. Love's worried about nursing home spread.
And that would break my heart. It would break my heart because I've been on the front line of this trying to make sure that none of our seniors, my mother, your mother, anybody else's mother, does not get sick and die from this, particularly if they're in a nursing home.
And so she's asking more questions of the Department of Health and Human Services, wants more investigation into this. In the meantime, the state rules are very clear that they want these positive COVID patients in separate sections of nursing homes or completely separated from the people who do not have the virus. And they say that they're going to continue looking at that, making sure that these regional hubs are following that policy. Reporting live in West Bloomfield, Rod Maloney, Local 4.
All right, Rod. Michigan's Attorney General is encouraging businesses to follow the governor's stay-at-home orders. If they don't, she's also encouraging police to step in and investigate. Following a warning, those who continue to violate the order could face legal action. Consumer investigator Hank Winchester is here with more now, including one example of a business that might draw some attention from the state. Hank?
Yeah, Devin, I talked with Dana Nessel about this. She's made it very clear that business owners should be following the governor's orders. They should be closed if they are considered non-essential. There is a business in Brighton, a gym that opened up at the end of last week, still remains open today, and that owner is not making any apologies. This Brighton gym making news after the owner decided to open up. He's going against the governor's order, but says customers were eager to come back and his livelihood depends on this business. While it was closed, like many, he was concerned about his financial future.
I listened to the orders, I shut my business down completely, but I went to work immediately in a different regard. I started researching everything I could on the subject.
But Michigan Attorney General Dana Nessel telling me that she wants action to be taken against those businesses violating the order. First step, a warning.
And there's never a set of circumstances where we don't issue a warning first and just say, hey, listen, that order's still in effect. Here's when it is in effect until, here's what it specifically says. And if they make the decision to go ahead and violate the law, knowing and understanding what the law is, then unfortunately they're going to have to pay the consequences for it.
Nessel's team has been in touch with police agencies across the state, asking them to investigate those businesses that are violating the governor's direct order.
We sent out a letter to all of law enforcement indicating that, we had really specifically looked at the law. We absolutely believe that these executive orders are enforceable and that they are legal.
For now, no action being taken against the gym in Brighton. The sheriff of Livingston County had this to say.
I made the decision that we are not going to enforce any of the executive orders anymore.
Back out here live, there are some police agencies that say they feel that the governor and the attorney general have stepped over their boundaries, that they don't have the legal right to enforce that stay-at-home order. There are others, though, who are complying with it and are taking the steps to launch investigations into businesses that remain open during the stay-at-home order. We're live here tonight. Hank Winchester. Help me, Hank.
Yeah, you got it. All right, Hank.
Well, now to the latest on the mysterious syndrome affecting some children that appears to be linked to COVID-19. It's being blamed for at least 3 deaths in New York and 1 in England. Today, we've learned more local cases as well. Dr. Frank McGeorge joins us with what parents need to know.
This remains rare, but doctors are seeing it in some local kids. Children's Hospital reported 15 to 20 cases over the past 2 weeks, and Beaumont says they've seen a few cases too. Mott Children's Hospital also had 1 possible case.
It can get serious very quickly, like within hours.
That's why Dr. Rudolph Valentini, Chief Medical Officer at Children's Hospital, wants parents to be on guard for signs of pediatric multisystem inflammatory syndrome. There have been 85 reported cases in New York State. Cases have also been reported in 10 other states and Washington, D.C., and there have been at least 50 cases in European countries. The symptoms in younger children include fever lasting at least 2 days, a rash, red or peeling palms or soles, red and cracked lips, and red inflamed eyes. Children may also have a strawberry red tongue. Older children and teens tend to have more subtle symptoms, including a fever lasting more than 48 hours, along with a rash or gastrointestinal symptoms like abdominal pain or diarrhea. In some kids, it has progressed to toxic shock and heart failure. The CDC and New York State are working on criteria that can be used nationwide to identify the disease. The bottom line:
if the child is not right, they have fever and they're just not right, if they have any of these other symptoms, please call your pediatrician. If you can't reach your pediatrician, if you can't be seen by a doctor, go to your local emergency room, preferably one with expertise with children.
Experts believe the syndrome may be resulting from an unusual inflammatory reaction to the coronavirus and may appear several weeks after the initial infection, even in children who never showed symptoms of COVID-19. Now, most children are recovering, but if you notice symptoms, you need to call your pediatrician right away. Back to you.
All right, Frank. Sadly, in the midst of a pandemic, the need for funeral services has skyrocketed.
Yeah, and now a new order from the State Department of Health is shortening the timeline of laying someone to rest to avoid spreading the virus. Our Grant Herms explains how that's already affecting funeral homes and how it's likely to affect families.
The new state directive is a much smaller window than many in the business of death are used to dealing with, and while many say they haven't had too many issues so far, it's adding another layer to an already difficult process. Outlined in a new emergency order from the state health department, the window for finding family and arranging a funeral have gone from days to hours. The new order says hospitals and funeral directors only have 24 hours to notify the person in charge of a body. After that, it's 48 hours to make arrangements, a fast-moving process for such a difficult time.
Yeah, what the orders are designed to do is to facilitate the process of leading to final disposition, to relieve the pressure that funeral homes are feeling with regard to the sheltering of remains during this COVID-19 pandemic.
But it's not just the arranging that's changed. At Verheyden Funeral Homes, nearly every step of putting a loved one to rest has changed to avoid spreading the coronavirus. Rotating family in for visitation 10 at a time, socially distanced seating, and taking extra steps while preparing and handling bodies.
There are some challenges back and forth because of customs and religions and so forth, but at the end of the day, as long as everybody stays in their lane with it, it all works. But it's an education.
The folks at Verheyden here say they haven't had too many problems finding family and making funeral arrangements for a loved one that needs to be put to rest. They say a lot of that is because of hospital staff, county office staff, and their own staff, which have been a big part of laying loved ones to rest in such an unsure time. Grant Herms, Local 4.
All right, Grant, let's get to some breaking news just into us. Some Art Van furniture stores could reopen under a new name. A U.S. bankruptcy judge has approved a deal that includes a private equity firm in Texas buying 17 now shuttered Art Van locations in the state of Michigan. The sale could be finalized this week, and it may pave the way for those stores to reopen, again, as I mentioned, under a new name, though with the potential for the company to rehire some of the laid-off Art Van employees. We'll stay on it.
Yeah, we will. Well, those blankets or tarps or whatever you used recently to cover your sensitive plants, you're going to need those again. Let's go ahead and check in with Ben.
And an extra one for your bed, too, because we've got record cold tonight, 20-degree temperatures. It's the last time we will see those in the forecast. Find out what the ceiling is on the warm coming up.
A club in Detroit for children is reopening their doors today. I'll show you the safety precautions that they're taking and how they kept those kids entertained for the last couple of months.